Welcome, everyone. Excited to have you with us today. I'm giving folks a second to join us so that no one misses anything. But I'm seeing those numbers climb, and I think we are ready to go. We've got so much good content to cover. So welcome. If you've joined one of these before, you already know my spiel. My name is Carrie. I work at Spruce Health. I will be serving as the moderator for today's event so that I can help guide the discussion in a meaningful way and get your questions in front of our speaker today. We are joined by Michelle Bruenn. She is our implementation specialist at Spruce, and she is our resident expert on all things Spruce. She is really excited to be sharing some of our newest and most innovative features with you today, and I'm excited to hear her talk about them as well. But before we get started, just some real light housekeeping, and then I'll let Michelle take over. With respect to getting your questions in, please use the Q&A function at the bottom of your screen. We've disabled chat because it's just a lot cleaner for you to drop it right into Q&A, and we're going to save a bunch of time at the end to get through them. So as you think of them, drop them in, and I'll be monitoring that closely. Also, this session will be recorded and shared a little later today with everyone that registered. So if you have to drop off early or you feel like you've missed something, don't fret, because you will get access to that recording soon. And with that, I think I've covered it. I'm going to pass the baton and let Michelle take it away. Thank you, Michelle.
Thanks so much, Carrie. So today, here's our agenda. This looks like a lot, I think, but we're going to go through things piece by piece. We're really talking today about how you can structure your communication with your clients and also with your team internally to make Spruce, really a tool that can make your practice more efficient. So let's go ahead to the first slide. All right, so the first thing we're going to talk about today are scheduled messages. This is a feature that has been part of Spruce for a while, but I really wanted to call this out because I do find that some of our customers aren't aware of this feature or haven't used it very much. Scheduled messages are part of our basic plan, so this is accessible to all of our customers. And this is possible for both internal and external messages, as well as for both secure messaging and standard text messaging. And I really think that scheduling is fantastic for structuring your communication and internal reminders, managing your workflow, planning follow-up, and even sending forms prior to an appointment. So in terms of structuring communication with patients, I think the example that I often give is clinicians who answer a lot of messages after business hours, but don't want their patients to think of them as being accessible after business hours. So rather than send all of that communication at 8 or 9 p.m., you can schedule all of those messages to send at 9 a.m. the next morning, so that your patients understand when you're actually going to be available to them. In terms of internal reminders and managing your workflow, I previously worked as a practice manager for a large mental health company, and I loved being able to schedule internal messages to my team because it allowed me to really structure how my administrative team functioned throughout the day. I could schedule tasks for different times of day to make sure that they took care of things at the times they needed to be taken care of. And I could also schedule internal reminders for myself so that, I didn't necessarily have to have a massive to-do list or a list of pages that I had to get through that felt really unstructured. Instead, I could say, I want this page to come to me, next week at 4 p.m. because that's when I have to do this task. So in terms of follow-up with patients, for similar reasons, this is really great because you can have an appointment with a patient and during the appointment, schedule a message either for yourself or 2 weeks later saying, hey, you have to follow up with this patient about, this treatment situation. Or you could be scheduling an external message to the patient saying, hey, it's been 2 weeks. Make sure that you reach out to the office to make your next appointment. If you are using secure messaging, hopefully you have encountered our Spruce Visits feature and have tried out sending those forms via secure messaging to your patients. This is really nice for having forms sent prior to an appointment and scheduling that in advance. So for a lot of people who work in mental health, scheduling, for example, the PHQ-9 to be sent to their patients prior to an appointment is really helpful and allows them to not have to think about that during the appointment itself. So let's take a look at how we schedule messages. All right, so these screenshots are showing scheduling on the web interface. So on the left, you can see that when you select that little clock that's in the bottom underneath the compose bar, it opens up this box that allows you to set any date and time in the future. So by setting the date and time in the future, you're choosing when that message is scheduled for. And after it's been scheduled, you can see on the right that you'll be able to view that scheduled message and edit or delete it up until the time that it is scheduled to be sent. So in this case, you're seeing a scheduled secure message, and you can see that we've included that Spruce visit, the PHQ-9. As I was previously saying, that can be a really great thing to schedule in advance of a visit. If you move to the next one, we'll see you can also do this on the phone. So here you're seeing screenshots of the phone interface. You can see in the same way all the way on the left. If you first select that little clock, it is allowing you to choose the date and time. And after that, you can see that there is a scheduled message there. If you select where it said scheduled message, it would open it up so that you could see it and edit it, which is that image all the way to the right. So I love that this is accessible on the phone also. So many of our customers are frequently on the go, using Spruce on their phones, and having this functionality be something that is part of the app, I think makes it much more powerful and really something that allows you to structure that communication with your patients in a meaningful way. There's so much temptation because Spruce is on the phone to respond to patients immediately. And sometimes that creates a bad behavior on part of the patients where they're thinking, oh, you must be available at 9 p.m. every night because you sent me that message at 9 p.m. the other night. And by being able to schedule these messages right on the phone, it really gives you a lot of power as a clinician to communicate with your patients clearly and have your time be more structured. So that is scheduling messages. And the scheduling tab is the aspect of this which is actually new in Spruce. And if you have noticed this, or if you haven't, you will see in your black menu bar on the web interface toward the bottom, you'll see the scheduling tab. And this is a new concept where you're able to see all of your scheduled messages in one place. This can be tremendously useful if you're, for example, using this to send a form to all of your patients before their appointment. And maybe one of your patients cancels, and you can very easily find the scheduled message to them and delete it. Or maybe you have, scheduled messages to a bunch of people about how you're going to be out of office, and then your plans change and you want to be able to change all of those quickly. This is something that you can do all at once. You can also see here that if you are the admin user on your account, you are able to see everyone's scheduled messages. So this can be helpful if, for example, you're overseeing an administrative team and one of their tasks is to send appointment reminders through Spruce. You can review their work this way and ensure that they actually have set up those reminders for everyone that they're supposed to send them to. So that can be a really nice thing in terms of management as well. And if you are not the admin user, you're only going to see your own scheduled messages here. So then it's a little bit cleaner for you. You're only looking at your own messages. Okay. All right. In terms of sending the same message to many patients, rather than scheduling individually, if you are on our communicator plan, you can use our bulk message feature. So bulk messages are fantastic for a lot of reasons. They can be great in situations like, hey, I'm going out of town, don't forget. They can also be great in terms of letting all of your patients know about changes to your practice. Maybe you have a new clinician who is joining, or you're opening a new location, or your hours have changed, or you've decided to start providing a different service or a new type of treatment. So in all of these cases, a bulk message can be very useful for reaching a group of patients at once with the same message. You're also able to send messages to a group of patients rather than to all of your patients. And this is really helpful in situations like group therapy, for example, where you might want to select the 10 patients that are in a group and send them a reminder in bulk. You can also find this to be really useful if you have multiple providers in your practice and you want to send a message to all of the clients that see one of those providers, but not the others. You're able to attach files to bulk messages. So if you create a monthly newsletter for your practice and you want to add that to the message as a PDF, that's something that you could do with bulk messaging as well. So a lot of uses for this. And I think that, sometimes it's actually underused because many, clinicians aren't used to being able to communicate this way. And I think it's a nice one to explore and think about how it can be useful to your practice, how you really want to market services to your patients specifically. So you'll also notice when you send a bulk message that you have the option to send a bulk text, a bulk secure message, a bulk email, or a bulk invite to the Spruce app. So one caveat I want to make about bulk text messages is that carriers are increasingly marking standard text messages as spam when you send large numbers of messages in one day. So I would caution you perhaps to encourage your patients to use the app if you want to do a lot of bulk messaging so that you can do it with secure messages, or try using bulk email instead of bulk text, just as something to be aware of, especially if you have over 500 patients who you might be reaching out to at once. Okay. All right, so the bulk message tab, this has recently been totally redesigned and I love it. I think it's really exciting to get to see your bulk messages this way in, a real organized form instead of seeing them send and then kind of having no record of them afterwards. So I think this is a huge upgrade. You'll notice that there are two tabs. There's queued and there's completed. So queued messages are those that you have scheduled to send, but have not yet sent or are in the process of sending. And the completed messages are those that have already been sent. You can see in our demo account here that actually all of the completed messages have the status canceled because we have not actually been sending bulk messages to all of our fake patients who are ourselves. But you would see the status completed there after it had been sent. You can see what the message is. You can see who it was sent to. So in these cases, you can see that it was sent to people with specific tags. And you can also see the type of bulk message that was being sent. So this is a really nice record to have. It's nice to be able to look afterwards and see who sent the message, who it was sent to, that it actually was completed, and having things, having the ability to schedule bulk messages has been huge for a lot of our customers who like to communicate with all of their patients and want to be able to set this up in advance rather than needing to do it, at a precise time. Right? So when you're creating a bulk message, this is something you can do from that bulk message tab that we just looked at. It's also something that you can do from the contact list. So when you open up this dialog box to create your new bulk message, you're going to see that it asks you specific questions. It asks you for the recipients. These are the contacts who are being sent the message, and the drop-down menu there will show you your different contact filters that you've set up. So you can set up a contact filter for everyone with the Michelle tag, and that would be one of your options here that you could select. If you were doing this from the contact screen, you could also check a number of those contacts and select bulk message from the top rather than creating a filter first. So the next part here shows the delivery. So this is the link or phone number or email it is being sent from. So the Spruce link, especially, I think, can cause some confusion for people. So it's an important one to notice what link or phone number are you sending from. And if you're sending a secure bulk message, it's also going to ask you what conversation this will post into. So is it creating a new conversation if that client does not already have a secure conversation with that link? Or is it only sending this if it does in fact have that conversation? Or does it send this in any conversation that patient already has? So I know that can be a little confusing, and I'm happy to answer questions on that, especially if anyone has, run into some difficulty with this with bulk messaging. At the bottom, which you can't see in this screenshot, it asks for the date and time the message should be sent. So again, you have the ability on the communicator plan to be able to schedule these bulk messages. Okay. All right. The next thing that I'd like to talk about is a new feature, which I'm finding many of our new customers find super intuitive, which is great. I keep telling the engineering team that they did a great job with this one. We now have a schedules feature built into the user interface, so you no longer have to go to Spruce support and say, hey, I want to change my hours. Now this is something you can do yourself, which I'm sure many of you have already set up and is really exciting because it gives you a lot more control of how you're messaging your patients at different times of day. It gives you a lot more control if you want to make changes, especially if you're making changes for a limited period of time. So once you have a schedule, you'll be able to set your auto replies and phone trees to that schedule. Again, this is a communicator plan feature. So what's also nice about this is if you have individual clinicians that are using their own phone number or their own Spruce link, they're able to have a separate schedule that they're using for their own communication. So for example, if Dr. Brown has completely different hours from Dr. Smith, Dr. Brown can have his auto reply going off during his after hours rather than needing to have one set of hours. And that's something that they would both be able to control on their own. All right, so when you're creating a schedule, there is a schedules tab under settings, and you would just go ahead and say create new schedule. You can give this a name, make sure the time zone is correct. You can make a choice of whether this is something you can edit or anyone on your team can edit. And then you can go ahead and input your hours. you're also able to create something called a recurring exception. So for many of our customers, they have different behaviors for their call handling during lunch times, for example. Everybody goes to lunch from 12 to 1. They don't want the phone to ring. So you're able to set up when your lunchtime is as a recurring exception. So generally, I found most customers are finding this pretty straightforward to use. I'm happy to answer any questions for people who are trying it out for the first time, or have specific needs that maybe don't seem like they're being met with this yet. But we're very excited about this. It really has a lot of utility and is moving us in the direction of more of the configuration being self-service, which is ultimately where Spruce is going. All right, so one of the things that you can do entirely on your own now is set your auto reply to a schedule. So the most common use case here is that someone wants a specific auto reply outside of business hours. So after their hours, they want a text message or a secure message to then trigger an auto reply. So to be clear, an auto reply that you're setting up is not triggered by a phone call. This is something that is triggered by a secure message or a standard text message. And you can think of this as the same as the auto reply that you get when you send a message in your Spruce support thread. When you send a message in your Spruce support thread, you get an auto reply that tells you what our hours are and how you can mark your message as urgent. So the auto reply that you set up functions the same way as ours does. So you would go into your settings to auto replies, and you'd create your auto reply as you see it on the left there. You would name it, and you would be able to manage it with a schedule. Now, when you choose a schedule, you choose the name of the schedule you've created, which might be main hours. And then it's going to ask you what time period you want this to be triggered. So is this during your office hours, or is this outside of your office hours? So if this is an after hours auto reply, you would want to say outside of your hours. It's also going to ask you for triggers. So that would be the phone number or the Spruce link that this should trigger for. So for example, if I'm Dr. Brown and I have a direct line and I, would like to have my direct line have an auto reply after hours, then the trigger I would want is my direct phone number. And I would check that specific phone number as opposed to setting it for everything. So that's another one I find sometimes causes some confusion. People set it up and they don't choose one specific thing. And then they find that that auto reply is sending for all communication, and that wasn't the intention. So that's a good thing to be aware of as you're setting it up. You really do have a lot of granular control in Spruce. And that can be a little bit overwhelming when you're doing something for the first time. But we're very excited to be able to give you that granular control because we know that our customers have really specific needs, and we want Spruce to be able to meet those needs as much as possible. Now, what you're going to see on the right here is an auto reply that was already set up. And here you can see that it's currently on because it is after hours for this practice. And you see a button that says override. So for example, if I've decided I'm going to work on the weekend, so I don't want my after hours auto reply to be triggering on the weekend, I can override it, and then it will continue to be turned off until its schedule shift happens according to the hours. So in that case, it would then continue to be off until the next after hours period began. So that's another one I'm happy to answer questions on. But yes, this is auto replies. This one is all you now, which we're very excited about. Applying a schedule to a phone tree. Here, the phone tree itself still needs to be built by the Spruce support team. And we are looking to have this be something that will be part of the user interface in the future. I'm very excited about that. I think there are a lot of customers that are going to really love having full control. For right now, the Spruce support team still needs to create the phone tree, but once it's created for you, you're able to apply this to any of your numbers and you can manage it with a schedule. So you would go into phone SMS and phone numbers. You'd select the number that you were looking to make changes for. And at the top, you would see the option to apply a phone tree. When you selected that option, you would have this box come up and you can turn on answering calls with a phone tree. And then you can turn on managing with a schedule. So once you've done this, again, you'll select which schedule you're using. And then it's going to give you the different time periods that are set up with that schedule. So that might be business hours, lunch, after hours, or it might just be business hours, after hours, depending on how you've set up your schedule. And then each of those is going to be a drop down where you can choose which phone tree is set for each of those hours. So if you filled out, 3 different phone tree requests for business hours, lunch, after hours, you would see that there were 3 different phone trees to choose from after the team had created those for you. So you would choose which one is set for each of those time periods. Now, you might want your lunch hours to just have your after hours tree. Maybe your after hours tree is just a voicemail that says, hello, we're not able to answer the phone right now, please leave a message. And that applies to both of those situations. Maybe you want that to be a totally different thing. So you've made a separate request for your lunch hour tree. So that's, a really nice function for you to really have visibility into how your phone number is set up and be able to make changes. You'll see that once the phone tree is active on the number, you have that same override button that you do for the auto replies. So you're able to override that phone tree temporarily if you want to be closed over holiday, or you want to be open over a weekend. So again, I think this really gives you a lot more control than you've had previously and a lot more visibility into how something is set up. So you can go and look at this and have a sense of what's going on with your number and make changes yourself. So we hope that this is going to make our customers feel a lot more in control and, really allow you to do some troubleshooting on your own if your phone number isn't behaving in the way that you had expected. So that's my overview of the different.
Yeah. Very good stuff. You covered so much great content in a nice succinct half hour. Thank you for that. And we have had some questions come in, so I am going to just softball them your way. Starting up at the top, and if you don't know the answer, no pressure. We can always follow up after. But this first question from April is starting new private practice and she's a newbie. Does Spruce integrate with ICANN Notes, electronic health record?
We don't have an integration set up with that platform at this time. However, Spruce does have a public API. And if you're interested in learning how you can integrate with, whatever EHR or other platforms you're using, we're happy to give you more information on the API. And I think we're very excited to see what other platforms are interested in partnering with us in the future.
Excellent. Here's another integration question. Actually, this is a couple of questions sort of built into one. So any integration with Google Workspace / Calendar is the first part of the question.
So I think this would be the same answer, that we don't have that integration currently. It's something that you could think about whether the API could be useful. I'm not sure if Google Workspace or Calendar is HIPAA compliant, or if there's a version of it that's HIPAA compliant. That's something I'm not familiar with. So I think that would be one consideration in thinking about any kind of integration there.
So you must be a mind reader, because that was the second part of their question, is what kind of HIPAA compliant security is there for patient info? And I have to agree with you, I'm not sure either. So that's something that this person may want to dig into. Multi-factor was the last part, but I'm not sure if you know the answer to that. I don't know it.
Yeah, I mean, Spruce is a fully HIPAA compliant platform, and we do have a white paper about Spruce and our HIPAA compliance that you can find in our help center. And we're always happy to answer any specific questions about how Spruce is HIPAA compliant and, how you can use it with patients in a HIPAA compliant way. So we're very committed to that, as, Spruce is a platform that's dedicated to clinicians. So this is something that we've made for you, and we are really centered on it being HIPAA compliant for you.
Perfect. Kelly has a question. Do you have to have the person tagged, i.e. group therapy, physical therapy, etc.?
Yeah, so I'm guessing that this is a question about bulk messaging. And there are two ways to set up your bulk message. So if you're setting it up from the bulk message tab, you do need to have a filter that's been created, which, would be based upon tags, where you had gone ahead and tagged, group therapy Monday, on each of the patients that applied to, and then created that filter with the rule tag group filter Monday, so that you could bulk message everyone in that filter. If you wanted to do this as more of a one-time thing, you could go right into your contact list under all, and you could just scroll through and use that check mark to check all the people who you wanted to bulk message. And then you'd see bulk message as one of the options up at the top. So that's a really nice option if you're just kind of doing this as a one-off. If you're doing something like group therapy and you probably want to send them a message, every week as a reminder, or, send them after those sessions, worksheets, other things that they might need to do at home, that would probably be a good use case for just setting up that filter and having it in place.
Okay, perfect. Thank you. Question from Jennifer. She would love it if you could expand a little more on how to schedule on the web, and also how to schedule an internal message reminder for herself, as you had mentioned earlier.
Yeah, absolutely. So scheduling on the web, similar to scheduling on the phone, underneath the compose bar. And actually, Carrie, could you pull that slide back up so we have that visual back?
Yeah, let's go back. Hold on. There we are.
Yeah. So you can see on the left here, you have a conversation open, and you have the compose bar at the bottom, which is where you would type your message. And this is set up as external. So you see that it's white and it's a secure external message. And there's that little clock symbol, which I know is kind of small. All the way at the bottom, it's the rightmost symbol, it's a little clock. And that's what you click on to open up this box to choose the date and time that you're scheduling for. And it's the same process if you're scheduling an internal message. You would want to click on the internal tab so that you are scheduling internally. And if you were scheduling it as a reminder to yourself, what I would often do is page myself. So use that @ symbol and my name so that this would come up in my pages when the scheduled message sent. And that's a nice one to play with. I sometimes do that in onboardings. I have people schedule a message to themselves at the beginning of the onboarding so that at the end they see that pop up. So that's, a nice one to just try out for yourself and see if that really works with your workflow.
Perfect. Thanks. And that tackled the scheduling the internal message reminder. Yeah.
Yeah.
Okay. Just making sure. All right. Perfect. Next question. And let me just drop us back onto this slide. Are people on the basic plan who already have one schedule auto reply grandfathered in, will they be able to remain using this feature?
It's a good question. So the decision was made when schedules moved into the user interface and became a communicator feature, that those who are on the basic plan, who already had a schedule in place, would be grandfathered in with that schedule. So you'll be able to continue to use that schedule and to set things to that schedule. You will not be able to create new schedules if you are on the basic plan. So if you decided you wanted multiple schedules for some reason, that might be a reason to consider upgrading.
Okay, perfect. Thank you. Let's see here. Nicole has asked, if I have a scheduled message going out on May 25th, what does the presets mean? For this message, it says tomorrow at 9 a.m. What is it saying?
So the preset, when you open up that box, the automatic preset is tomorrow at 9 a.m. But you can select any date and time, on that little calendar and with the time column there, if you want a different date and time to set that message. After it is scheduled, when you click on that scheduled message, it will tell you when it is scheduled for. So if your intention was to have it be May 25th, but when you open up that scheduled message, it says tomorrow at 9 a.m., you might have made a mistake when you were scheduling it. And no worries, you can go ahead and click edit and you can change the date and time.
Okay, great. Adam is asking, what if two schedules overlap? Will both auto replies be shown?
Okay, so I'm imagining you have two schedules, maybe Dr. Brown and Dr. Smith have different hours, and you've set one auto reply for after hours for Dr. Brown and a different auto reply for after hours for Dr. Smith, but they overlap because neither of them are working at midnight. The answer is that both auto replies would send if they were set to the same trigger. So if these were both set to your main phone number, then yes, they would both send at the time that they were both set to send. You might be sending them for different phone numbers, in which case them, both sending wouldn't necessarily be a conflict. If you're trying to do something where you want two different after hours messages for the same phone number, I'd want to hear more about the use case for that. And you'd want to try to figure out how to create a schedule for each of those messages so that they don't overlap if you didn't want them to.
Okay, perfect. Thank you. Let's see. Claire is asking, she says, I'm having issues with the CSV bulk message lists. They're not uploading or not uploading correctly. Is there a trick to it?
Okay, so you're importing a new set of contacts by CSV, which it's not precisely what we're covering today. I think often, there are issues with uploading CSVs when the format is not fully correct. I also see issues come up when there are special characters or the columns are not matching the columns that are in the template. I recently had someone who changed it to just be one name column and got rid of the first and last name columns, and it didn't know what to do with that. So I think you have to kind of assume that the upload doesn't know your intention and needs to be told something the exact way that it's expecting to be told, and really try using that template very exactly to make that work. If you're having a really hard time with it, if it's not working, I would encourage you to reach out through your Spruce support thread and let the team know, and they're happy to help you with this. I believe there's also a video of how to do this that you might want to review if you haven't already.
Perfect. Thanks, Michelle. Miranda has a question. Does Spruce have to set up auto reply similar to Phone Tree, or can this be set up by our staff?
Auto replies are fully self-service. So you can do that just by going to settings, auto replies, and you can create them there. So your staff has the ability to do that on your own. I do want to stress that auto replies are responses to secure messages or text messages. That's what you're setting up. So you're not setting up a text reply to a phone call. So I get that question pretty frequently of like, I want to send a text for a missed call. That's not an auto reply that you can set up yourself. That's still something that the Spruce support team would have to set up for you.
Perfect. Thank you. For the folks who may have joined us late and they're wondering if this has been recorded, it has. And I will be sending a link to this recording later today. So keep your eyes peeled for that. And then you can rewatch all of this and focus in on the sections that are most relevant to you. So don't worry if you missed part of today's presentation. It is recorded and you can watch it over and over and over. I know I will. Okay, let's see. Someone has asked, can you split patients in Spruce between two different offices, having certain patients assigned to a certain clinic?
Yes, you can use contact tags to tag different patients as, Austin versus Dallas. And that will allow you to sort them in filters and contact filters so that you can see each list separately. It's also possible, we do have some customers who have, totally different staffs for different locations, and they don't want those contacts to be shared. It is also possible to turn on a setting called contact membership so that you can limit which staff members see which contacts, if that's important to you. I think that probably answers the question.
Yeah, perfect. Love it. Karina has a question. How do we bulk message in an easy and functional way as we receive new patients? Can we just add to an original bulk message? Is there an easy shortcut to filter new members? I found it difficult to send bulk messages when not all patients are registered to Spruce, therefore it's defaulting to SMS.
Okay, so a few things here. One thing actually, which I'm reminded by this question, which actually is an excellent point to bring up. If you set up a bulk message in advance, say I've set up a bulk message registered for, everyone who is registered for an event I'm having next week, and I have a registered tag on those contacts, but it's not actually sending until next week. If I add 30 more patients to that registered list, the bulk message will send to everyone who has the tag at the time that it is scheduled to send. So you can keep adding to that list, up until the time that it's set to send. which I think is really nice because it makes that scheduling function really like a lot more usable, because you don't have to have your whole list together before you're scheduling it. So in terms of being able to know who your new patients are, this is going to be part of your workflow in terms of how you're using tags to designate people who are older patients, or, you know, are already active, or people who are pending. And I would encourage you to think about what sort of tag would be a good designator and how you can put that into your intake workflow in a usable way. So I do know some practices will do something like, you know, add a new patient tag and then have as part of their workflow that that tag has to be removed after a month. That can be too manual for some people. So, you know, there are possible ways to say, like, you know, oh, I go through this list frequently and I, you know, remove people from it at certain intervals. It really depends on your workflow to think about how to make that set of people distinct. In terms of people who do not have the app yet, yes, it is true that you cannot send a secure message to someone without the app. You can see everyone who you have invited who has not yet set up the app by selecting the list under contacts that says pending. That will show you everyone who has not actually set up their app yet. So that can be a good place to look to say, I want to send a bulk message to that group of people, reminding them that they need to set up the app.
Perfect. Okay. Joe is asking, is there a time frame when patients' text messages fall off the board or out of the system?
I think you're asking, are we storing things indefinitely? And yes, we store things indefinitely. This is part of HIPAA compliance because these conversations are part of the medical record.
Perfect. Okay, great. Let's see. Boop, boop, boop. So an anonymous attendee has said that they've heard great things about Spruce. Thank you. Where can they find more info to trial demo before opening their private practice?
If they go right to our website, you know, it has a nice button there that says start your free trial. And you can go ahead and do that independently. You can also reach out to our sales team. That information is there as well. You know, if you do have questions that you're hoping to have answered before trying Spruce.
Yeah, perfect. And one thing I'll also mention to the group at large is we have a pretty robust YouTube channel with a ton of training videos. So please feel free to check that out as well. And I can include a link to that in the follow-up email so that everybody has the direct URL. Good question there. Okay, Claire has asked, she's saying that she's receiving messages like unable to parse headers. Oh, I think this goes back to the maybe the CSV, I'm not sure. Unable to parse headers from CS, column fields must be unique, encountered duplicate. This account is not authorized to access the requested resource.
Yeah, so the column headers issue, I would go back to the template and see how your columns may be different from the template columns. I know that can be frustrating. And again, absolutely reach out in the Spruce support thread if you do want our help in doing that. I know that that can be a tricky process. The not being able to use this resource, I'm less certain about because I'm not sure exactly how you're seeing that. But I will say that I believe the contact import is an admin function.
Okay, perfect. And I think there was a follow-up later. I'm just going down the list from top to bottom, y'all. So now, but I see something from Claire later on saying that was supposed to be part of the first question, we can disregard. Well, thank you though for answering that, Michelle. Love it. All right. let me see here. I'm not sure, because you're the expert, Michelle. I'm not sure if this is a question that you'll be able to answer, because I'm not understanding it. But here's a question that says, how can I add a doctor for a period of time for coverage?
So this is a question we get a lot. We would recommend that you add them as a teammate, and then you can remove them as a teammate when they're no longer covering. Spruce does charge by user, but you are prorated for the amount of time that someone is on the account. So if they are covering for a week, you're only going to be charged for them being on your account for a week. The reason I say that this is the ideal way to have coverage in Spruce is that that person will then actually have access to all of your messages and your patient contacts, and will be, more functionally able to cover for you. It is possible to have your phone number simply forward to an outside number so that that person could answer your calls. But the difficulty with that is that although they could answer them, if they did not answer the call, they would have no access to missed calls or voicemails, because those are stored entirely in Spruce. So that handicaps them somewhat in being able to effectively cover for you. So we do generally recommend having you add them as a teammate temporarily and remove them again. And there are specific things that you can do within Spruce for somebody who is a teammate to cover for you. These would include having them set as the teammate to ring for your number. Also, being sure to add them as a member of your number if you have a direct line that's private. Making sure that you have set up a filter for them that shows your assigned conversations, or a tag-based filter if that's how you're managing your workflow. So this can be, pretty specific to how your practice is set up. But we're happy to answer questions about that. Please reach out in the Spruce support thread. I also encourage you to reach out somewhat in advance of when you will be out of office, because I am aware that when people reach out immediately before leaving on vacation, there's a lot of stress involved in that.
Perfect. There was one follow-up question from this same person asking, what if that doctor has a Spruce account for their own practice?
Yeah, so they're able to have, access to multiple Spruce accounts. They'll need to set up their provider account with your account, with a different email address, but it can be the same phone number. And they would just need to log in and out of the two. Or if they're using it on the web, they could have Spruce open in two different browsers or in an incognito window so that they can have both open. They will still be able to receive phone calls for the Spruce account that they're not logged into. So that, often is, a major question that I get. It's not possible for them to have access to your Spruce account because they have their own. They still would need to be a teammate within your account. In terms of ongoing communication, if you and your colleague both communicate with Spruce, we do have the ability to do secure clinic-to-clinic messaging, which I think can be really great if you're often referring patients to each other. You can send medical records securely to another provider who uses Spruce, and you can even set up a group conversation with the other clinic and your patient so that you can do a warm handoff.
Perfect. Thank you for that. Allie is asking if you can just go over again how to change the phone tree schedule within Spruce.
Do you want to go back to that slide? I think it's the last one.
Yeah, let's see. Yep, perfect.
Yeah. So when you look at your phone number in Spruce and you're on the tab that says call handling, when a phone tree has been created for you, you're going to see that as an option at the top. It will say apply phone tree to this number. And when you go ahead and click on that, it opens this box. and you can turn on answering incoming calls with the phone tree. That's that first toggle that you see. And the second one says manage phone tree with a schedule. When you turn this on, it's first going to ask you which schedule are you using, because as I said, you might have more than one. And once you had done that, it's going to show you those different time periods that you can apply a phone tree to. So that would be business hours and outside of business hours. And you can say that you want the clinic hours phone tree during office hours and the after hours phone tree outside of office hours. So the phone trees that will exist in that drop-down menu are the ones that the Spruce support team has created for you. So we do have some practices that might have 10 different phone trees because they have 4 different locations, and each of those locations has different phone trees. So in that case, you might see, Austin business hours, Dallas business hours, as different options in those menus. But for the vast majority of our customers, it's going to be 2 possible phone trees, and you're choosing which one for each scheduled time period.
Perfect. Thank you. That's great. A quick one here. Is the patient agreement and the BAA the same thing?
So the patient agreement is the patient's agreement with Spruce, that they're agreeing to our terms and conditions. The BAA is the organization, your clinic's agreement with Spruce, which has to do with our HIPAA compliance, that we are a protected vendor.
Okay, great. And where would they locate that patient agreement to have for their telepsych office?
So you can, the patients are going to see it when they set up the app. That's in the terms and conditions that are there. It's also in our help center. If you send a message to Spruce support on your Spruce support thread and say, I'm not sure where to find this, can you send it to me? They will be able to send that to you.
Perfect. And if someone wants to obtain a copy of our BAA before signing on with Spruce, can they do that? They want to review it prior to opening an account.
So where do we find it? Trying to think. I think you can find it in the help center. I know that when you're going to set up the account, it's in the terms of service, but I imagine if you wanted to look at it beforehand, you might not want to look at it during the sign up process. And in that case, I believe it is in the help center.
Okay, perfect. And I can dig into that too, and maybe even include a link to that in the follow-up email. And then we have one last question, which I'm going to just quickly pull out because then we're going to be at the top of the hour. So Steph is asking, how can we change how our phone/messages appear to patients? We're considering condensing our admin numbers to have fewer threads. And if we tag patients by location, can the main or admin be separated by tags so that different admin teams can help? We're struggling as to how best to grow with multiple locations.
Sure. So I think if I'm understanding correctly, you have patients that are part of different locations, and you want to be able to segment those in a way that the correct admin team can work with them. But you're thinking that you want to stop having different phone numbers, and you want to be able to segment them without having different phone numbers. I'm not sure if I'm understanding that correctly. That's what I'm hearing. If you wanted to do that, you could tag them with the location. You would want to tag the contact with the location, and each admin team could set up a filter showing the contacts, the clients with that location tag, so that they could focus on the group that they were assigned to. That would certainly be one way that you could do that. If you're using multiple numbers, you can have each number auto-assigned to a team so that the group of people on that team would automatically get those messages in their assigned to team Austin filter. So there are different ways of doing that depending on exactly what's going to work for your practice.
Perfect. I love it. Well, we did it. We're only a minute over and you covered so much incredible content. Thank you so much, Michelle. Today was incredibly enlightening for me, for this group at large, I'm sure. I will follow up with a link to this recording. And if anybody has any follow-up questions, you can always reach out to support. But I know that I think the crux of them will probably be answered and you can re-review this content later on your own timeline. So thank you, Michelle. This was terrific and look forward to seeing everyone at our next session.